Welcome to Getting Understanding. I'm your host, Dr. Darrell Ellis. I wanted to touch bases with you a little bit as we continue discussing different medical topics and different approaches to treat patients' diagnoses about what we as physicians go through when we make a decision. And basically, most of us who are allopathic physicians who are trained and educated in the treatment of different disease states also are educated in using a certain paradigm when we make those treatment decisions. And that's the paradigm of risk versus benefit. I hear from a lot of patients who just are not interested at all in being on medications for their various medical conditions, whether it's their diabetes, their cholesterol, their high blood pressure, because they've heard about all the potential side effects that can occur. In many cases, a lot of these patients aren't aware of the fact that just because there's a listed side effect to a medication doesn't mean that you necessarily will get that side effect if you take the medication. Reason being is that when they do their drug research at the pharmacologic level, any side effect that occurs during the clinical trials, whether it's related to the use of the medication or not, has to be listed as a potential side effect once that drug is approved by the FDA. So again, in many cases, you'll see a listed potential side effect, and it may have happened in 1 in 100,000 patients who were involved in the clinical trials, but it needs to be listed. So just because it's there doesn't mean it's necessarily going to happen to you if you take the medication. Now, back to my point. Your physician's responsibility, or one of their responsibilities, is to take a look at what your current disease state and your disease process is for you as an individual. Let's use diabetes as an example. If you come to me as a diabetic patient and your glucose is very poorly controlled, we use a blood test called the hemoglobin A1C to evaluate that. Depending on how that hemoglobin A1C is, will determine which medications have the greatest potential to work well for you and work well in a fashion that won't cause you necessarily severe side effects of dropping your blood sugar too quickly. That's one of the risk versus benefit assessments we have to do when we introduce a medication for that particular problem. Also, we look at your comorbid medical conditions. Many diabetic patients also have heart disease. They may have renal problems or kidney disease. They may also have problems with their cholesterol. There are different diabetic medications that can provide added benefit of not just lowering your blood glucose, but also causing potential benefit and or decreasing the risk of progression of the other comorbid medical problems. Renal insufficiency or kidney disease, one of the most important ones. Cardiovascular disease, again, a very important potential consequence of poorly or untreated diabetes. There are specific medications that have specific recommendations and indications for use in patients who have those comorbid problems. Most physicians, as a matter of fact, all physicians who are doing what they're supposed to be doing, are going to start you on the lowest possible dose of whatever medication they introduce you with. And then they should be following you up relatively quickly in a short interval, 2 to 4 weeks, to make sure that number one, you do tolerate the medication appropriately before they start to titrate it up to actual physiologic and or therapeutic doses to allow for the best benefit. That make sure there's no biochemical evidence of organ damage from any medication that we provide you. If you're on blood pressure medicine, we have to watch your kidney function. You also have to watch your electrolyte balance. If you're on diabetic medications, in addition to watching your hemoglobin A1C for response, we have to be sure, depending on which medication it is, with cholesterol medications, we watch your liver enzymes, we watch your muscle enzymes, to be sure that we are being consistent with our oath that we take when we become physicians, and that is to first do no harm. It's important for you to have a doctor-patient relationship with your physician where you trust your doctor, understanding that when he makes a recommendation to you, he's already vetted that medication or that intervention for you specifically. He's looked at what your risk factors are, he's looked at what your current disease state is, and he's choosing an option for you that's going to provide you with the greatest benefit with the lowest degree of risk. If you don't feel comfortable with your physician to that degree, then I think you should keep shopping. If you do, then you need to have that open conversation with them. When the conversation begins about how we're going to address your problem or your issue or your disease state as to what are the risks and what do you think my chances are of developing those risks given the benefit that you think I'm going to get from this particular intervention. It's an interaction that needs to occur between every patient and every doctor. Because just like it's the doctor's responsibility to try and find a way to treat your problem at the lowest risk, it's you, the patient's responsibility to be your own advocate, to be sure that you have a clear understanding of what's being done and why it's being done, what the potential risks are, as well as the potential benefits. That's how you develop that doctor-patient relationship. It's a mutual trust, and it's a team approach to make sure that the best outcomes can occur. If you have questions, if you want to know more about this specific topic, make sure you put us some comments into the comment section below. If you're not subscribed, I'd love for you to hit that subscribe button. Also hit the bell notification so that we can notify you when new topics are introduced. And lastly, I would love to hear from you in terms of additional topics that you would like to hear about. It's more important for me to talk about things that you want to hear about so that you can be informed than it is for me to just bring out topics that I think are important. Because ultimately, the purpose of this channel is to inform the public about medical issues that most affect you.